Good day, everyone. Inapo alira kiros montiel. Anya voatea intuhiaki mayo meshika hamu. Osinchim na wuring. Welcome to the presentation on a healthy tribal community will. I'm the Director of Health and Human Services at the Intertribal Council of Arizona. I've been there since 1990, and my principal responsibility is to analyze and address health policy formation for tribal communities here in Arizona, and I also have similar project in Nevada and Utah. So welcome to this presentation. I'm joined today by Ms. Kim Russell, and she'll introduce herself. We collaborated on this project for developing a healthy tribal community will.
Hello, everybody. My name is Kim Russell, and I'm the Executive Director for the Arizona Advisory Council on Indian Healthcare. I've been a part of the state agency for almost 8 years now. The work that we do really closely with the LEDA and Intertribal Council of Arizona is policy development, health policy development. I'm of the Bitterwater people, born for the Tangle people. My maternal grandfathers are of the Coyote Pass people, and my paternal grandfathers are of the Bitterwater people. I am originally from Chinle, Arizona, but I live and work here in Mesa, Arizona.
So what comprises a healthy tribal community? In this project, we answered this question. Our goal was to answer this question. What comprises a healthy tribal community? So in 2019 and 2020, with the support of the Vitalist Health Foundation, the Intertribal Council of Arizona convened sessions with tribes to develop the elements of a healthy tribal community will. With 17 tribes participating, the will was developed based on this input. Long-standing values are identified that align with factors that contribute to one's personal health and more broadly to the overall health of a tribal community. The will is a tool that can guide policy development, funding sources, and the programs through health and human services operated by tribal governments for their communities. The will corresponds to traditional knowledge of the 4 directions, including the stages of life, medicinal plants, animals, and the healing ways that align to the quadrants of the earth and sky, which we call the 4 directions. The center represents the core of Mother Earth. And next, you'll see this next circle represents the soil. Next, the rivers and oceans that give us sustenance. So the participants identified the factors that enhance our personal health and that of our families, and how these link to the overall well-being of a healthy tribal community.
Through our conversations with tribes, they gave us more information about how they define a healthy tribal community. They said that a healthy tribal community is one where families have the opportunity to live in balance from birth to an elderly age, with environments that are clean, safe, and promote wellness. They also said that through a tribal perspective is that one's health is influenced by cultural and environmental knowledge that sustained tribal communities prior to colonization, that may have been adapted to influence our quality of life now. And these factors stem from overarching values that have continued to influence individual wellness in our tribal communities today.
And I'm going to describe the healthy tribal community will. We came together with a common will because we realized with 17 tribes participating in the project, we have common views, but we also have unique differences within our tribal communities with regard to the healing ways and with regard to the 4 directions. So we came together and described the center of the will. That's the core of the earth, and it equates to fire. We represented it by a copper color because the fire is also the hearth of the home. The next circle around the center, around the copper color, is the soil. So around the earth is the soil. The soil is the foundation upon which we build our spiritual, emotional, mental, and physical balance throughout life. The next circle is the family. And a child's learning experiences with your parents, siblings, and grandparents and extended family provide the foundation for growth into adulthood. The next circle is the community. The tribe said the community is viewed as your extended family upon which relationships are formed and interactions occur. Then we put a circle around the community to represent water, because water is life and required for survival of all creation. Our next circle, we identified the contributing factors of a healthy community. These factors are listed on the wheel, but they continuously revolve in a circular motion under the 4 directions. That's important to understand when interpreting this wheel. And then around the 4 directions, we have a circle of people. And that means that the elements of the wheel are all interconnected and can be used to guide policy and program development in a tribal community.
Now I'd like to discuss the 4 tribal principles of sustaining health. And then when you reference the wheel, it's going to be the outer circle of the wheel. The first one is beliefs in spirituality. We have long-held foundational knowledge based on traditional cultural practices, also with a connection to sacred plants, places, and animal knowledge, and for some of us, faith-based religious experience. As tribal nations, this is the core part of our tribal communities, as well as resiliency and way of life. Resilience is a cultural value or trait that helps one cope with life's challenges, striving for balance when there's imbalance and resource in negative situations to sustain the tribe or one's way of life. And as tribal populations, we've been very resilient and are still here today. And then third, self-determination. And this encompasses decision-making, policy or program development based on a tribe's choice, in which outside influences or policies are weighted factors of consideration. And then sovereignty and tribal governance. All of our tribes have some form of tribal government infrastructure, and that it's internally influenced by cultural values and their norms, historical factors, and actions in which policy implications have been considered. Those are the 4 tribal principles of sustaining health. I also want to talk about a lot of the conversations we had with our tribes, which revolved around social determinants of health. And I'll talk a little bit about a few of those social determinants of health. Tribes have elevated public health as a consideration that contributes to one's personal health and, of course, to the public health. And these factors include a focus on the public health infrastructure, such as access to clean water, food security, and environmental considerations. Some social determinants of health include, but not limited to, quality housing, employment, sustainable economies, improved educational systems, sound social justice systems, community safety, transportation, and cultural foundations. Now we are going to discuss the 12 contributing factors of a healthy tribal community. And you will see that on the wheel, it's in green, and there's 12 of them. I'll hand it over to Alita to describe the first one.
The first contributing factor is social cohesion. So social cohesion is found when you have supportive relationships, clan systems, nuclear and extended families. Your home place is a central focus. A tribe can consider resources for housing maintenance and beautification. A tribe can consider protecting livestock and pets. A tribe can consider supporting mental well-being through their programs and services and child welfare services. A tribe can consider and they do consider opportunities for recreational activities and sports. The tribe can consider, and they do promote, opportunities for engagement with arts, music, and culture, including traditional practices. A tribe can focus on robust social and civic involvement to help the people. So there's opportunities for input from tribal members. And also community empowerment leading to positive systems change. So all social cohesion is an ongoing effort. And the health impacts include economic stability, community welfare, and all aspects of spiritual, mental, emotional, and physical well-being being satisfactorily addressed. The next contributing factor is social justice. So we've know for years, and we've experienced historical trauma and address historical trauma and structural racism within our tribal policies. We're promoting restorative and transformational practices. We're addressing incarceration policy, adding diversion and reentry programs, ensuring that sentencing and corrections do not adversely affect disadvantaged subgroups within tribal populations. We're also pursuing fair distribution of resources to the Bureau of Indian Affairs for tribal adult and juvenile correctional facilities. And we're also enhancing medical and behavioral health staff to provide services in the BIA and tribal adult, juvenile, and correctional facilities. So the health impact of ensuring that there's a contributing factor of social justice is addressed will have longevity, physical and mental health, intact families, community well-being, social cohesion, and these can be based on tribal solutions.
I also want to add here, Alita, a lot of the work that's been happening around the social justice contributing factor in relation to the missing and murdered Indigenous people policy movements that have been happening across our country, and more specifically within our state here through the study committee that was legislatively created. And through that, different recommendations and policies have come forth for tribes, the state and federal government to consider that will help address the missing and murdered Indigenous people issue that we've been confronted by.
The next contributing factor that our tribal work groups identified was the environment. So having clean air, rivers, creeks, and waterways, having healthy and clean soil, having water security and water supply protection, having tobacco and smoke-free spaces, also minimizing toxins and greenhouse gas emissions, such as carbon dioxide and methane. Also, affordable and sustainable energy use, and minimizing solid waste disposal adequately. So there are numerous health impacts when you consider the environment and having efforts such as health promotion, disease prevention, childhood brain development that could be impacted by environmental considerations. Also, environmental considerations could reduce asthma and other respiratory diseases. And of course, reducing exposure to environmental contaminants such as lead. An important contributing factor is access to care. We're talking about accessible, high quality medical care and insurance coverage. We're talking about integrated and coordinated systems of medical care and public health services. We're talking about having trusted health professions that align services to your cultural values of your communities, and also incorporating traditional practices and cultural values into a wellness designed health system. We're also talking about the development of federal and state policy guided by tribes and health equity achieved. One of the ways that we utilize the will to promote health policy is an example that my colleague Kim Russell is going to talk about.
One example I'd like to mention here in regards to how we use the wheel, and when we took a look at the wheel and the different contributing factors in regards to access to care, is we worked on a policy with our tribal leaders and our state government to create a 6-area health education center. It took us 3 years, but we passed the bill earlier this year, and the governor signed the bill into law. And this new AHEC is going to solely focus on the Indian health system. And what it's going to do is to create more American Indian health professionals so that they can then serve our tribal communities. Wanted to share that example of how we've used the healthy tribal community and turn those discussions into policy development. And very soon here we will realize the 6-area health education center.
Another important contributing factor to a healthy tribal community is food access. This is important because you can see the direct results in healthcare if you have enhanced nutrition, better food choices, preventing obesity and other associated diseases. If you can promote cultural knowledge, which helps with your mental well-being, and also tribal childhood brain development, so for all of our children. So how would a tribe utilize this contributing factor? What kinds of policy or programs would they consider? So they could strengthen their local food systems. They can promote affordable, accessible, and nutritious food for their population. They can promote access to healthy food to enhance food security. They can look at sustainable agriculture, livestock, and wildlife protection practices. They can focus on ensuring that there's traditional plant gathering, habitat preservation for traditional plants, and access and utilization by tribal members. Clean water sources is an important aspect of food access, and also USDA policies that favor tribal gap food handling, so we can promote our traditional foods and make them available on a broader scale. Land use and preservation is another important contributing factor to a healthy tribal community. So what is required there? Natural open spaces for plant and animal habitats and appropriate human interaction, having sustainable grazing policies and agricultural buffer zones, preserving sacred sites and traditional gathering places for shared use opportunities within the tribe, supporting policies that protect cultural, archaeological, sacred places, and historic sites, and having opportunities for engagement with traditional arts, song, dance, and traditional games. We also have land use policies that do not negate federal law, such as the National Environmental Protection Act, the National Historic Preservation Act, and the American Indian Religious Freedom Act. And at the local level, you could have community parks and affordable, safe opportunities for physical activity.
Now we're going to transition into another quadrant of the wheel. And this is underneath the quadrant where it's listed self-determination. And we're going to talk about economy, education, and safety. But please remember the different parts of the wheel, the different circles. Remember, they are always moving. But we'll talk about that quadrant. So we'll talk a little bit about the contributing factor of economy. And this means recognition of traditional jobs. This could include the jobs that, for instance, are people that are jewelry makers, silversmiths, blacksmithers, rug weavers, basket makers. It also means increased meaningful employment, having a living wage, and access to capital for tribal and tribal member entrepreneurship, as well as access to affordable and diverse small business commercial spaces for tribal member enterprises. It also includes tribe job training and mentorship accelerator space, local talent development, and location of commerce mindful of open space and land use considerations. And I'll add access to internet and media, reliable access to internet and media. Some of those health impacts would include economic stability and access, strategic decision to promote land, water, and air quality, walkability, physical activity, and mental well-being. Now I'd like to transition to this other contributing factor of education. Very important to a lot of our tribal people. And this is an investment in support of our tribal members and residents. It also could include native language revitalization amongst our tribal communities, which is very important so that we can hand down those teachings from our elders. It includes opportunities for developmentally appropriate, affordable child care and early childhood education programs. We have a very strong system here in our state. Opportunities for high quality and accessible education from K-12 all the way to GED. And then access to a variety of post-secondary opportunities, such as at our tribal colleges and universities. It also encompasses Native American focused career development and advancement within our tribes. And then also, like I had mentioned earlier, the concept of focusing on growing our own in health careers, like the work that we'll be doing shortly through the 6th AHEC. And then opportunities for transmission of elder knowledge. And also, we need to be mindful of involving our tribal and school libraries in this conversation, and of course, also at health events. The health impacts could be greater educational achievement, economic stability, American Indian professional development, and tribal members beginning to operate departments and programs.
The next contributing factor that's very important is safety. So if you have socially connected communities free of crime and violence, we're talking about community cohesion that encourages positive social interaction. We're talking about fair first responder policy development and practices that are inclusive of the input of reservation residents, and coordination with tribal courts, health and human services, and employment opportunities. This one example I could share with you is something that the tribes worked on, was getting a state law passed that would provide recognition of tribal court orders for involuntary commitment. So that was a health impact, it was a health issue where we didn't have substantial higher level of care for patients that required inpatient mental health treatment. So through a state law, we were able to provide recognition of tribal court orders in the state superior court system. We're able to process these orders so that individuals could get inpatient mental health services through the state behavioral health system. So that's why this type of coordination is provides for the safety and well-being of our tribal communities. So overall, if you can address safety, then you have injury prevention. You could possibly reduce your correctional and detention services. You could look at inmate medical and behavioral health services and supports. And then when they get released, coordination and increased positive community involvement for these individuals. As we go around the wheel now, we're going to continue to talk about these contributing factors and going to move into the description of transportation.
So another important contributing factor of a healthy tribal community, transportation. This is something that tribal communities, both rural and urban, need to consider for their tribal members. This includes safe, sustainable, accessible, and affordable transportation options. It allows people to connect with places including parks, retails, and schools, that promotes built environments that encourage walking, biking, and taking transit systems. It also allows for access to IHS tribal and urban Indian healthcare services, and also allows access to health fairs, workshops, conferences, weekend and evening events. Some of those health impacts could be reducing obesity and promoting disease prevention, promote disease prevention, increases physical activity and mental well-being, economic stability, air quality, and unintentional injury prevention.
Community design is an important contributing factor of a healthy tribal community. So within the tribes, they can focus on culturally appropriate community development. The tribes in our work group also focused on maintaining environments free of excessive noise and light pollution. They also talked about how you can reuse and adapt vacant land. They talked about access to shaded spaces, green and open spaces, including a healthy tree canopy. Also, within community design, tribes can work on community gardens and agricultural land. They can ensure conservation techniques, mindful of your agricultural wildlands buffer zones. They can work on protecting their archaeological, historic sites and sacred places. Tribes can incorporate traditional structural design in the building plans, and then they can require energy efficient structures.
Now I'd like to address the last and 12th contributing factor of a healthy tribal community per the wheel that we're presenting to you today, and that's housing. Housing's so important to our tribal communities. Housing's important to everybody. And this would include having affordable, high-quality housing options through HUD and other agencies. It allows for policy funding that ensures water wells, on-site wastewater systems, connecting homes to community water and wastewater facilities, and that upgrades our old water supply and waste disposal facilities. It could also include energy efficiency and gray water reuse opportunities, and it could include provision of housing services for seriously mentally ill and other vulnerable populations. I also wanted to include a recent example of some discussions we've had with our state leadership about building housing that would be our traditional housing, our traditional dwellings, such many of our tribal communities still have and use today. And some of those health impacts could include economic stability, disease prevention, environmental quality, federal regulations preserve mental and physical well-being, childhood brain development, injury prevention, and it addresses exposure to extreme climates and also could reduce exposure to it.
As we talked about this wheel, I just want to point out one more thing. Around the wheel, you'll see the people. You'll see the circle of people, and we included that in our design because we wanted to show the interconnection of these contributing factors to the health of the people. Our traditional practitioners that participated in these work groups talked about these 4 quadrants, and to always remember, like at the top of the wheel, we're under the sun. You see the sun. At the bottom of the wheel, you'll see the moon. To the left, you'll see the stars. And to the right, you'll see the rain, the clouds and the rain. So we're always a part of the environment. And these factors contribute to health in terms of being in alignment with our environment and our ways of life. Our key advisors for this project included Ms. Kim Russell, who participated today in this presentation, Mr. Michael Allison, who is the Native American liaison at the Arizona Department of Health Services, recently retired, but he was a great contributor and key advisor to this project. And I'd also like to thank the participation of staff at 17 tribes that attended these sessions. We really appreciate your input and all of the information that you provided for this wheel.